Excited for today's episode. We are going to dive into how to evaluate children from economically diverse backgrounds. We're going to see how can we determine whether it's a language difference or a language disorder. We're also going to look at what goals are going to be pivotal in improving communication and academic outcomes. Joining us today is going to be the leader in our field in culturally, linguistically, and economically diverse children in assessment and intervention. Her name is Dr. Celeste Roseberry-McKibbin. She has over 70 scholarly publications. She has 16 books published. We are so fortunate to have her today. She is going to give us so much information about how we can effectively and fairly evaluate children from low-income backgrounds. She is also going to share with us what game-changing goals are to make a difference with this population. I'm so excited to have her here today. I had the pleasure of attending a full-day workshop in which she explained the impact of poverty on language development and what we can do about it. It was an incredible workshop. Today, she is going to share with us what you can use on Monday morning to confidently assess and provide intervention to children from economically disadvantaged backgrounds. It is such a pleasure to have her here today and to share with us how you can come in the form of bread. She truly is an agent of change who not only dedicates herself as a professor at California State University, Sacramento, but also works within the schools of the San Juan Unified School District, which is highly diverse. I can't wait for you to come away with great information that you can use on Monday morning so that you can make a difference. Dr. Roseberry-McKibbin, today we are going to dive right into what do we do on Monday morning to change lives. The first question that I have for you is what tools should a speech language pathologist use with a child who's from a lower socioeconomic background so that they can fairly assess this child and not rely on standardized tests that weren't created for a child with this background? How can we assess their language in a fair and valid manner?
Kelly, it's a real honor to be here. Yeah, I work full-time as a professor at the university and then 2 Fridays a month directly with children ages 3 through 22. So it really keeps my feet on the ground. The first problem to me in assessment is that most of our tests are knowledge-based. You take like the Self-5, the Peabody, any of that. We're assessing their background knowledge was very limited because of their backgrounds. This is usually a whole day workshop, but we're diving right into the meats. The biggest thing we need to do is assess working memory. Research began in 1998. They found that kids with language impairment significantly have difficulty on non-word repetition tasks. My YouTube channel, Celeste Roseberry, if you type in that, it'll have it. So it would be things like, I want you to say ga, mi, fa, da, and then have them repeat back. And it's pretty crazy because I've had kids from ages 4 through 16 do this, and they all fall off a cliff after 3 digits or non-words. I love this because it rules out the variable of background and not being exposed to things. There's just lots and lots of research here. Was it SES did not matter. If they had a language impairment, they had difficulty with non-word repetition. So I would start there. We all know about dynamic assessment. We all know about language samples, but working memory, I have done it for years and it has never, ever failed me. So again, just lots of studies around that.
I love that because this is truly what dynamic assessment is. Every child comes in with the blank slate.
Yes.
No child has heard this 5-syllable nonsense word that you're going to ask them to repeat. This is so fair. This is so valid. Thank you so much. And we don't learn about this in graduate school. We learn
Mm-mm.
about this in continuing ed courses. Thank you for bringing this research to practice, Monday morning practice, and saying, hey, this is what the research says. This is what you're going to do tomorrow.
It's just very exciting to look at. So it's quick, it's easy, takes just a couple of minutes, which is very, very nice. The CTOP 2 has a couple of things that we can assess, and those are some other potential things. And so we want to, again, rely on things that don't rely on prior knowledge. I want to cut to some super exciting stuff on fine motor. One of the things that I've been doing is looking at fine motor skills. So I've been having the kids write to dictation. And this is not auditory memory. And so this takes me like 6 minutes, honestly. You can see that this is a fifth grader who's pretty typical good writing, typical good writing. They thought all these kids had language impairment, definitely a severe learning disability. I make up the sentences out of my head, and it just takes a couple of minutes. But these, you can see how successful this is. Definite language impairment there, language impairment there, not there, not there.
For those viewers who are listening on the audio podcast, what are the qualitative differences that you're seeing in fine motor from the children that are elementary age that have language impairment with those that don't have language impairment?
The kids who are typically developing, their letters are pretty even, their spelling's pretty decent. The kids who have language impairment, their letters are large, they're immature, they're sometimes the letters are flipped backwards. Like my son has dyslexia, that's what he did. And so you can really see, if you guys just start to do this and have faith, you'll be able to quickly see the differences there. This was super exciting, and I wanted to make sure we got this in. This came out in the ASHA Leader last year. They did a meta-analysis at Georgetown University, and they looked at basically patterns to abnormalities. And so they found in these 577 participants with true underlying DLD, in 100% of the cases, there were abnormalities in the anterior neurostriatum within the globus pallidus and the basal ganglia. This has very strong scientific evidence that is it environmental or DLD, we need to screen gross and fine motor. One thing I do, and for those of you just listening, I have the child touch their thumb to each finger of the hand. If you Google it, it's called finger to thumb opposition. 100%. If kids are good and smooth with this, starting at about age 6 or 7, they don't have DLD. But the ones who are searching and awkward, 100% have DLD. It's amazing. And here's the scientific proof right here.
If the child is preschool age, would you ask the parent to describe their fine motor skills during the screening process? Would you get that information on whether they're delayed, they're on target, they're advanced?
100%. So this, I'm going to make up a name, Ivan. Ivan's a 3-year-old Russian, almost nonverbal. Lots of, I asked mom about it because her English is pretty good. Lots and lots of fine motor problems, very late to potty train, lots of behavior issues. We just did that last year, and now he's on the caseload. It was pretty much all parent interview because he was pretty untestable. An interview form, an intake form that you can use with caregivers to find this kind of stuff out.
I like what you're saying. This reflects your knowledge base because you've written books on intervention in motor intervention and social intervention and language intervention. You don't treat a mouth. You're saying if you're looking at a language disorder, you need to look at the whole child. You need to look at the social emotional. You need to look at the fine and gross motor and diagnosing it.
Kelly, amen. I couldn't have said it better myself. I have them hop up and down on one foot. I have them catch a ball. When you start doing this, you will quickly see that kids who have underlying DLD really have trouble. And then I have them do cross crawl. If you just Google brain gym cross crawl, the kids, even as little as 3 that I've assessed, because that's mainly 3 to 11 is who I mainly see, they have trouble. And parents will report they're late to potty train, they can't zip up their clothes. That's a big red flag. We can totally interview parents and get all that.
That's wonderful. That's such important information. And we weren't taught this in graduate school. We weren't taught this in their continuing ed courses to have a fine and gross motor section on our evaluation. That's something occupational therapists do.
Right.
What would you recommend to stay within our field of practice? How would we report that on an evaluation? Would we say our observations of fine and gross motor? Would we include that in our evaluation report?
Yeah, so this is a really good question because obviously we want to remain legal and stay within our ethical boundaries. So I'll say this examiner noted that when Ivan was given X, Y, and Z he displayed a great deal of difficulty. It is this examiner's hypothesis that he may have blah, blah, blah. This is only a hypothesis and must be treated as such until he can be evaluated by appropriate professionals. Big caveat.
So when we're talking about, is this language difference or is this a language disorder? What you're looking at is, let's look at the working memory. Let's look at the gross and fine motor skills. Let's look at the social emotional background and really look at the child as a whole when we're determining whether or not there is a language disorder or whether or not this is simply language difference. This is really important what you bring to the table and how we can evaluate children in a culturally, linguistically, economically diverse manner. So thank you so much for these
Sure.
wonderful nuggets of information that unfortunately we didn't get from graduate school. We didn't
Oh,
get
right.
courses. Thank you so much for that. Now we have this information. The next series would be like about goals. What goals are going to be the most pivotal in changing the trajectory for these children with developmental language disorders or developmental language delays?
Okay, so Kelly, I'm going to begin with infant because it really starts there. And so we can work directly with families. Research is conclusive if there's affordable childcare, that's kind of ideal. Lots of research if it can begin in infancy. So Fowler et al. Studied these two groups of infants, 4 months of stimulate. For one group, they started language stimulation at 4 months of age. In group B, they began a language stimulation at 12 months of age. They followed all these kids into adolescence and in high school. The kids who started the language stimulation at 4 months of age wildly surpassed those who started at 12 months of age. What we're discovering now is that first 6 months is a very critical window for linguistic growth. Families need to read to the baby, talk face-to-face contact is ideal, label common objects. My TEDx talk is called The Phone to Prison Pipeline. Our devices endangering our children's futures. I think the biggest thing, Kelly, and I don't want to sound preachy, but we have got to get off our phones and pay attention to our kids. It's just really critical. The baby can look in a glass mirror. We can label body parts, heighten our facial expression. Turn-taking games are really important for setting the foundation of joint attention. So I like the turn-taking games. And then putting objects in and out of containers is good. Introducing two languages at birth. And Kelly, here's the kicker. And they have research out of Sweden too. What we used to think is the waterfall of words was just talk, 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 talk to your child. Thomas Lamonde and Markland et al. Found that what's the most important thing is to respond right away. If a child reaches out and goes, ah, oh yeah, you see the watermelon over there. But what really harms kids is when they repeatedly try to get our attention and we're ignoring them. That is killing us. It really keeps me awake at night. The quicker they were, the faster the children's language developed. So responding rapidly is the best thing that we can do. How often the mother initiated wasn't predictive. The significant factor was if the mom responded. So responding in the moment is key. And Markland et al. Found the same thing in Sweden. Okay, so the biggest one I wanted to share, the faster we respond, the more those children's language skills are going to grow quickly.
You bring up some points that we rarely talk about. The immediacy in the response, how quickly the parent responds to the child's bid for communication, and how responsiveness is more important than initiation when it comes to the parent. And that's interesting to me because many of us are from highly individualistic cultures. Like I'm Finnish in background, and collectivistic cultures, such as Latin American cultures, are more likely to be responsive in nature. And that is more beneficial for parents to take a responsive role to their child.
Kelly, thank you. So well said. And one of the big things, I work in a very, very low income area. A lot of my parents don't speak English, and poverty is a big issue. What I tell them is if you even look at a book with a child and talk about the pictures in Bulgarian, Spanish, Hmong, that's just as good as reading. And they really love hearing that because they feel very inadequate about
Mhm.
their literacy skills. Here are some ideas for preschoolers. The biggest thing I did with my own son is extensions, adding words. So the child says, kitty. Yeah, there's a fluffy orange kitty with big blue eyes. That if we can do that in any language, anytime during daily routines, and if you take nothing else away from this, remember that as number one, add words, no matter what language. And so again, we're just adding more information there. So we want to have, increased phonological awareness goals, as we know. These are some things that I do. I use fidget toys, which is really fun for them. I use a lot of folder games as well. Open manila folder with uppercase letters and then post-its with like ICK and AKE and AM. And the children can literally move those around and make words. It's such a cute idea. And research very much supports all of that. Now, this is the hierarchy that I'm not going to read to you for time, but this is specific, Kelly, what we can do for like IEP goals.
Mhm.
Count the words in a sentence and on it goes. But this is the hierarchy that I've used for years, and it really works well.
This is so related, phonological awareness skills to working memory. Do you feel that when you're working on phonological awareness skills, such as a lesion, for where you're saying cupcake, when I take away the word cake, what do I have left?
Oh, yeah.
A heavy working memory task. Do you feel that you're improving the child's working memory when you're working on these phonological awareness skills?
Oh, no question about it. Research is conclusive that it's reciprocal. When we're working on phonological awareness, we're also targeting working memory. Again, I feel like I'm sounding preachy, but I know you agree. Phones are just messing with the ability to remember, to visualize. Yeah, they're reciprocal. This is a little older kids now. We want to increase reading comprehension. Basically, that affects everything. We want to teach vocabulary and really expose our kids to print. And I've done a lot of research on this, that on phones and tablets are not nearly as effective as paper books.
Mm.
So I go to like Goodwill, the dollar store, because paper books are going to do a lot better with print exposure. And research is conclusive that little ones, as they get more into school age, maybe more screens, but little kids need those physical paper books in their hands.
That's very interesting. Yeah.
So basically, I use a lot of objects with my kids. If I use objects and hands-on, they remember a lot better than if I just have pictures or just explain it to them. So a big thing, especially with children from under-resourced areas, is to find as many objects as we can for them to have hands-on.
Wonderful. And I really like with the print referencing, you have them pointing to the word as spoken.
Yes.
Now, how important do you think that point is in pointing to the words as they're spoken? How important is the point?
Super important. Like, especially my son, as I said, had severe dyslexia. And so I did a lot of research on this. And research is conclusive that when we point and direct their attention to print, their reading really skyrockets. It worked for my own child and it worked for me.
Once again, you had that connection, that motor mind connection, whole body
Yeah.
experience. Yeah.
Yeah. When we see, we see. When we do, we learn. One of those. I have Miss Celeste magic words, and in therapy, I will teach kids the 30 most important words on the Dolch list. I will teach them how to sight read those because, and I won't read them here, but it's like the, of, and, because if they have to sound that out every time they're reading, it's going to really slow down their fluency. So I have these fun flashcards with spray glitter on them. And by the time the year is up, all my kids know how to read these sight words. And
Yeah.
it's really helpful. in
I
reading.
appreciate that you are a holistic interventionist, all of the above, where you see the importance of language processing, language comprehension, but you also see the importance of phonics and sight reading and fluency. It's not an either or proposition, it's all of the above.
No, it's not. I went to ASHA in Seattle in December of 24 and realized that what a rigid clinician I am. I was raised in Southeast Asia. My folks were Baptist missionaries. So I've stopped insisting that kids even sit in chairs during therapy.
Mhm.
Let them move around. We do breathing, we do affirmations. It's more trauma-informed intervention
Yeah.
because they've had so much trauma during COVID. Yeah,
And thank you for bringing that up. Many of the kiddos you work with are in fight, flight, freeze, amygdala, brain.
100%.
And now here we have tier two vocabulary words.
Yes. And this
Mhm.
is a point I really want to make because we don't want to focus on tier one basic words. I don't work on tier three highly specialized words. But basically, if we work on tier two words, that's the most productive for our kids. Words like fortunate, coincidence, similar, these words go across the curriculum. And so what we want to do is focus on those to get the more bang for our bucks. So again, obvious, complex reason. This is a teenage young man. I worked with young men out of juvenile hall and group homes. And so he had a lisp. And so we used tier two words to basically do like victory is triumph, courtesy is politeness. So especially for older kids, I find that to be really important. So tier two words are a very big deal. And then Kelly, if I can, there's something that I saw at an ASHA that I am just dying to share. There's a wonderful program out there that works with English learners, kids in poverty. It's called Prefix Reading Passages, and that targets morphological awareness, which in third grade becomes more important than phonological awareness. I want to really drive home the point that it doesn't have to be boring, but we've got to work on morphological awareness. Basically, what I'm showing in the picture, there's prefix anti, and then it's embedded in a story. And so antibacterial, antiseptic, antibiotic. Is it a verb, noun, or adjective? And this is a fantastic program, again, for our ELs and our kids in poverty to increase their morphological awareness skills. There's one more, it's freerice.com, and I like to play it too for myself, just the upper levels. Literally, if the child gets an answer right, bowl filled with little grains of rice on the screen, and literally a food insecure person somewhere on our planet gets rice to eat. It's just an awesome way of helping those who are in under-resourced areas. There's, I think, 52 levels of free rice on freerice.com. And this is marvelous for kids for improving vocabulary skills, and it's fun.
That is wonderful. You've given us so much in so little time. There's one area that we haven't had time to discuss, which is narrative developments and the importance of the complex senses at the preschool level and the importance of narrative development at the elementary school level. What are your thoughts on narrative development and that as a goal in improving language outcomes?
Yeah, that's so crucial with the narratives. That is key to reading. So when I work on narrative skills, I use a lot of sequencing cards. I got this from an audience member in New Mexico. So what she does with her Spanish speaking assessments is she takes 4 to 6 sequencing cards with familiar pictures and she mixes them up and hands it to the child and says, can you please put these in order? And every single time, if they have a developmental language disorder, they can't do it. If they're typically developing and it's just environmental, they can sequence those cards. So that's another really good task. But narrative development, I use a lot of sequencing cards, and we're a very high poverty school, as I've said. So I use the whiteboard a lot. So for example, for the teen young men I work with, very low comprehension. That's why they've committed crimes and they're where they are. I will have them literally on the whiteboard draw out the story in sequence, whether it's a high school reader or whether it's the rainbow fish or anything in between. And this has been like gold for me for developing those narrative skills. And then I will read a story with all my kids, no matter what the diagnosis, every single therapy session, at least one, because they don't get the exposure to books. Sequencing cards and drawing it out on the board is really helpful.
I've never heard of this before. That is such an interesting strategy, giving a child who's an English language learner a four-step sequencing card, such as making a peanut butter and jelly sandwich.
Right.
You're going to see that they can't put that in order. And that's going to be an indicator of developmental language disorder or developmental language delay and not language difference. I've never heard of that before. That's fascinating.
Yeah, thank you. That audience member had no idea what influence she had on me, but it works. It's really, I've never had it fail me ever.
You've given us so many wonderful ideas to put into practice on Monday morning. Thank you so
Thank you.
much for being a bridge from research to practice. I'm going to leave you with one final bonus question, which is in working with children who are from lower income families, if there was one piece of advice that you would give to a preschool speech language pathologist to always keep in mind.
I would say two things. One, use extensions, just 100%, because the person in the lowest income housing can add words to what the child said. That is my number one. And my number two is look at paper books with your kids and talk about the pictures. Again, that is just as good as reading. So extensions and paper books, whether they read or talk about the pictures, it's always so helpful.
Thank you so much for being here today, and thank you for the trailblazing work that you're doing. We are so fortunate for you.
Thank you, Kelly. It is so good to meet you.
Should we follow you and stay in touch with you?
Okay, thank you so much. I'm on Instagram and TikTok.
Thank you to Dr. Celeste Roseberry-McKibbin for bringing this important information to Monday morning practice. Now it's time for you to do what you do best, which is to roll up your sleeves and make the world a better place, one child at a time. You are always going to be